Hi, everyone. Welcome to my stream part 2 with the camera actually working. Oh, motherfucker. Technology. Why must you work so poorly? Welcome back, guys. I have no idea why that happened. I had everything primed, the webcam all set up, and it decided to just not show video. So hopefully everybody will find us on this live cast. And let me just do some tech stuff in the background here while I wait for all our viewers to rejoin us. Claudia, entertain the public, please. Very, very good. Can you guys hear me okay? Yay, sounds good. All right, yeah, as we're waiting for people to join us, let's do our little sound off. So let's everybody say where you're from. We already got somebody from Texas here. That's pretty fantastic. But we're going to just hang out for a bit. And because I'm doing this stream on my Clips channel and because of the mess up with the original stream, I'm just going to give it a few minutes to let people rejoin us before I start talking about anything interesting. And I'm just going to throw a link in the false start so people can find this particular, the actual live stream. Oh, I had such a good thumbnail with Claudia too. It's very disappointing. Edit that. We got the Minneapolis, Sonoma. Wow, lots of West Coasters here. And Coquitlam. Hi, Heather. There we go. Somebody from Ontario. That's nice. Florida, North Carolina. Okay, all right. So a little bit of East Coast. All right. Oopsies. Here. I gotta remember which keyboard I'm using. I don't know about you guys, but it is smoking hot in Vancouver right now. So it is very, very hard to be in a small studio with lights and cats. But we'll persevere. Hamburg. Nice. Guten Tag. Okay, I just left some breadcrumbs on the false start live stream so that people who look at it can find the actual live stream. Tech problems. So tragic. I guess maybe we should be more amazed that this is even possible and that it ever works rather than be disappointed that it sometimes doesn't work as well as we'd like it to. Isn't that right, Claudia? Yes, that's a microphone. Claudia agrees. All right, 19 people so far. That's great. A little bit down from the usual, like 600 to 1,000 that I see on my live streams. But, it's a start. It's a start. So let's give it a little bit longer. Laura's curious why people are giving cats green olives as a treat. I don't know. I assume their cat expressed a desire for olives at some point. I mean, they're probably salty, and cats do like salty stuff, so that would make sense. I know that thumbnail is fantastic, right? I hope people can find us. Oh, hi, Orsi. Nice. Thank you for joining us. Claudia definitely approves. Oh, we got some Albertans joining us. That's pretty awesome. Sarah's asking if a 4-month-old kitten panting after play is okay. Generally, you don't want to see cats panting, but you know, with kittens to go a little crazy, sometimes they'll pant a little bit. I wouldn't be too concerned about that. 1 second. I'm just going to look away from your guys' lovely chat for another moment just to see if there's anything else I can do on the tech side to help people find this. Channel, community, edit. Seize. Control V, that stuff. Okay, honestly, I have multiple computers going and I'm feeling a complete idiot because I'm using the wrong keyboard. Ha. There we go. Okay. All right, I think that's all the tech stuff I'm willing to do. All right, everybody, thank you for joining me. It's going to be a very small and cozy live cast today, but that is okay because hopefully it'll be up for many, many years and people will find it and find our discussion interesting and useful. I am joined by Claudia here for as long as she feels like hanging out. Her tail is fanning me. Maybe she's trying to keep the temperature a little cool. Yes, please give this some likes so people can actually. And yeah, there's definitely fewer people sub to the Eclipse channel. I'm actually doing this live cast to kind of promote the channel. I was hoping it would help a few of my followers to find it because, you know, it's pretty darn cute. And it kind of helps, you know, there's a whole algorithm thing. It's just helpful and gets the word out there. And hopefully we'll get more people to find my channel and get some free and helpful and useful pet advice. So while we're hanging out, I had some questions earlier in the chat on the original live stream from Jeff, who's one of my Patreon subscribers, whom I've been trying to help him counsel him over the last couple of weeks because his cat came back with a feline leukemia diagnosis. So he tested positive for female leukemia virus, and Jeff was very concerned about his cat. And he was asking me about the interaction between feline leukemia and hyperthyroidism. So, you know, feline leukemia is one of those things where it's a very common but commonly misunderstood condition. People, you know, we test for it because it's easy to test for and because, you know, you do want to have as much information about your patients as possible. But people get very worried when their cat comes back as FELV positive. And, you know, this is probably a good topic for a whole separate video where I can do a more in-depth review of what feline leukemia is and what the test means. But overall, it's a largely meaningless test in the sense that cats who are FELV positive live pretty much a normal life. It statistically increases the risk of a few minor health conditions. Claudia, what are you doing? Claudia's trying to knock over the light box. Good job. Very, very helpful cat. So yeah, it increases risk of some health conditions. And it also means that if your cat gets lymphoma, it might get a slightly more aggressive form of lymphoma, but it doesn't necessarily increase your risk of getting lymphoma. So it's a condition that slightly increases the statistical probability of rare complications to your cat's health. But overall, it really doesn't impact that much, and it's really not that much cause to worry. It has really minimal impact on management of other diseases and like our choice of therapies. So usually my advice to people who have an FELV positive cat is just to not worry about it. Now, the one I guess scenario where it does become a little bit more important is if you're thinking of introducing another cat to the household, because FELV is generally transmitted either through bites or more commonly through sharing food and water over long periods of time with a cat because it's carried in the saliva. So if you do have an FELV positive kitty, you might not want to adopt an FELV negative cat because it's not that fair to that cat because they'll probably become FELV positive. And oh my God, Claudia, why are you chewing on wires? You're not a rabbit. Claudia, off-screen naughtiness here. Here, if you're going to be wicked, you must be wicked on screen. There. So, I think if you have an FLV positive cat, I would not adopt an FLV negative cat because it's kind of unfair to the other cat, even though it probably won't make a huge difference. But the same virtue, if you have an FLV negative cat, which most cats will be, and you're thinking of adopting a cat, is a pretty good idea to get it tested because, again, you don't necessarily want to introduce an FLV positive cat into the household because it's not fair to your cats, because then they'll probably get it, and it might make there's a slightly increases the statistical likelihood of their life being slightly worse, which is not a terrible thing. It's not the end of the world, but it's also best prevented if you can prevent it. So I hope that answers you guys' questions about FELV, at least on the superficial level. And certainly if you have a hyperthyroid cat with FELV, it doesn't really alter how we treat it at all. Okay, so just before we get too far into this, please remember to like, share this. Obviously, this is kind of real time, so it won't really make that much difference if you share it right now. And hopefully, after we finish live, this will be obviously up as a video, and people will find this and get some useful insights out of it. Also, please don't forget, I think many of you already are my Patreon subscribers, but please don't forget that my Patreon sponsors, I guess, patrons, really patrons. I mean, I don't like to butcher the English language anymore, and I absolutely have to. So my patrons who support me through Patreon really, really help make all this stuff happen. And they really, I probably should be at work on clinics right now, and I'm not here with you guys. Part of that is because of the support of my patrons. So thank you very much, guys. And if you're not a subscriber already, please consider subscribing to my Patreon. It is wonderful. And it also provides you guys with extra value. So please check it out. Okay, there's a really interesting question here I really want to address. And there are some people piling into the room now. So welcome to everybody joining us late. And I'm really sorry about the switcheroo with the live cast. The camera didn't turn on with my original stream. Who knows why? I'm not a tech guy. I'm just a veterinary surgeon. All right. So Heather is asking, she had your 11-year-old cat whose T4 has been steadily creeping up, but hasn't quite gone into abnormal ranges. What to do? And her vet is pro fix it, don't treat it. Interesting. Okay, so you got to remember that when we're doing total T4s, a total T4 is a screening test, meaning it's not necessarily that sensitive, but it's it's cheap and easy. So certainly a trend over time, the thyroid creeping up is a sign that your cat may be moving towards being hyperthyroid, even if it's not hyperthyroid yet. What I would do, and what the recommendation is when you have a T4 that's steadily creeping up, or when you have a T4 that's at the top range of normal, is to do something called a free T4, which is just another blood test that has a higher sensitivity than a T4. So if you do free T4s on cats whose thyroid is creeping up, that might come back actually above normal ranges, and that will confirm your cat does have hyperthyroidism, is just early. Conversely, if you do a free T4 and it's within normal limits, then it'll just say your cat is heading towards hyperthyroidism, but it's not at a point which warrants treatment just yet. So I think it's a really useful follow-up to increasing T4. But yeah, if you have a elderly cat whose total T4s are gradually climbing up, it'll probably eventually be hyperthyroid if it's not already. And then of course, once the hyperthyroidism has been confirmed with an elevated free T4, then you can make that decision about whether to stabilize it medically or try to treat definitively with iodine 131 therapy. So I hope that helps, Laura. Or Heather, sorry, Heather. Yeah, so Anna has a question about radioactive treatment versus methimazole. She was told that it was more risky in older cats. I've never heard that. And I don't see why it would be more risky in older cats, because it's incredibly minimally okay, so here's what iodine 131 treatment looks like. You take a cat, you give it a pill, you put the cat in the kennel. That is it. Now, of course, the tricky thing is that pill has to be precisely calibrated to the cat, and that the cat's eliminations, so urine and feces, are going to be radioactive for about 7 days, which is why the cat has to stay in a special facility and not be sent home for a week. But risky? I don't really see where the risks are. I mean, the iodine 131 facilities, at least the ones I'm familiar with, are run by like incredibly, well, first of all, they're run by veterinarians. So your cat gets to live for a week in a vet hospital, essentially being cared for by a veterinarian and nurse. Quite frankly, it's probably less risk of anything during that week than it is staying at home with you, because it's under constant medical supervision. And the iodine itself, the reason we use radioactive iodine is because iodine is used by the thyroid gland. It's one of the components of the thyroid hormone. And most of the iodine in your body is stored in your thyroid gland. So when you give radioactive iodine, it localizes to one little organ. So there's little to no radiation exposure anywhere else in the body. So that's really, I think it's a really silly thing to say that there's increased risk in cats over 15 of age. Like it's totally awesome and really safe. So just don't worry about it. That's the summary. Don't worry about it. Forget about it. Just do the ID 131. Rick, I do look at my YouTube comments, but I can't keep track of all of them. Oh, I saved your cat's life. Nice. Aw, I'm very happy that my advice helped you. Oh, Sarah's asking about how to increase the activity of a stray cat she adopted. Okay, a little bit off topic, but sure. Look, first of all, make sure that cat is healthy. Lethargy is obviously a bad sign. So if you adopted a stray cat, get it checked out, get some blood work done, get fecals done for parasitology, make sure he doesn't have worms or a health condition. Let's say your cat is healthy and not that playful, particularly with a history of being a stray or a feral living out in the world. That might be completely normal, and here's why. So play behavior is basically training for hunting, for fighting, for surviving out in the world. Mostly hunting, though. So cats who've actually spent a lot of their time hunting and who have experienced being, catching live prey and eating it, are going to be less playful and less interested in play than, for example, a young cat or an indoor cat who spent their whole life living in your apartment and has never actually killed and eaten anything. So it's completely normal because they no longer need any training in how to hunt. And they know that, if they chew on something and it doesn't bleed and taste good, then it's not really worth killing, right? Because, if you think about it, if you're a wild animal out there, it's really important for you to learn what things are worth hunting and what aren't. If you waste your energy and time hunting things that aren't worth eating, they don't provide you with calories and nutrition, you're going to die. So an adult cat who has a history of hunting outdoors is probably not going to be that interested in playing with toys because they don't provide it with calories and they don't need practice hunting. So hopefully they'll put your mind at rest, but do make sure you give them a full medical workup first before just coming to the conclusion that they're just a trained killer who's not interested in your childish games. Bada bing, bada boom. Oh, you're welcome, Canadian. Is that a Grommet mug? Yeah, it's a Grommet mug. I love Wallace and Gromit. My brother got this for me, I think, when I was graduating from high school. All right. So just so you guys know, feel free to drop me a super chat if you really want me to see your question. It is a little hard for me to keep track of questions in the chat without long and boring pauses in the live cast. Of course, this live cast is pretty slow compared to my usual ones because for reasons we already described. But yeah, if you really want me to notice your question, then drop me a live chat. Or if you just appreciate the work that I do and want to give me a little tip, hey, I accept tips. A consultation with me is about $100. A consultation that lasts more than 15 minutes with a vet, with a specialist, is often about $300. So, 50 cents is probably worth it. All right, what do we got here? Rick reminds everyone, don't forget to drop out of chat and click the like button. Oh, thank you. Yeah. Tell YouTube that I'm at least as useful as a cat jumping through a hoop that gets 7.8 million views. Somebody asked, how do I get my cat to drink water? Oh my, so I'm actually making a video on this topic right now. I'm not going to tell you too much about it because I'm very, very very proud of what I'm about to produce. I think it's going to be hilarious. But what I'm going to tell you, because you joined me in live chat, is offer your cat options. That's really all you can do. Leave little water dishes around the house. In fact, I've been doing that right this summer for Mr. Pirate because he's a little bit arthritic. He doesn't get around as much as he used to, and it's a hot summer. So I basically put a little water dish right next to his favorite chair that he hangs out on. That way he doesn't have to walk across the apartment to get to his water. And he's been drinking a heck of a lot out of it. So I think you can't make a cat drink, but you can make it convenient for them to drink, and then they will. So multiple water dishes, particularly wherever your cat hangs out. And speaking of Mr. Pirate, I think I'd like him to make a cameo. He was in my arms when I started the original live cast. Oh, do not make this movement on YouTube when live casting people. Just free advice. This is an international symbol for carrying a cat like a baby, obviously. So anyways, he was in my arms, but by the time we figured out the tech stuff, he wandered off. This pirate is a cat. He's got his own mind. But I'm going to go get him. I'll be right back. Never mind. Mr. Pirate is missing in action. I have no idea where he is. He's not in his regular chair. That's what happens when you have cats. They just mysteriously disappear once in a while. I think a famous Hollywood star said, "Never work with children or animals." Personally, I quite like working with animals, but you definitely have to accept their nature. All right, let's get back to questions. And Mr. Pirate might just wander by at some point. Oh, interesting. There's such a delay on your comments. All right, guys. Mr. Pirate, is Mr. Pirate a trained killer? Well, I don't think he's ever actually killed anything. Well, I shouldn't say he hasn't killed anything. Mr. Pirate has killed a huge number of cockroaches back when we were living in Sydney, because for all of those of you from Sydney, Australia, cockroaches are endemic there. And Mr. Pirate and the other cats that I lived with in Australia were trained cockroach eliminators. He's taken down a few bugs in his time as well, but I don't think he's ever... And he also used to hunt skinks in the yard in Sydney. So he's caught a few lizards, but I've always managed to rescue them from him before he ate them. So I would say he's trained for killing, but he's not a trained killer unless cockroaches count. But he's certainly been training a lot. We do like to play fetch quite a bit. Oh, yeah, Claudia meows in the background sometimes. All right. Bada bing, bada boom. I mentioned taking a cat on vacation. Is that a terrible idea? It might be a terrible idea. I've certainly done it before. Look, again, this is a bit of an in-depth topic, but there's definitely cases where you can make a case for taking your cat on vacation with you. It has to be the right cat. Some cats deal with travel and change a little bit more, and it definitely has to be well planned. So you have to make sure that wherever you're staying accepts animals. You have to bring litter boxes and food. So it is really not an ideal solution in most cases. However, for example, like Mr. Pirate, he's super chill in the car. He loves walking on his leash, so he's easy to control. I would definitely do travel with him if I had to, but all else being equal, I'd rather leave him at home and just have him chill in his comfortable home environment and just have adventures out in the world without him, and then come back to him when I'm done. But you can definitely vacation with cats, but some cats are a little bit more amenable to it than others. That's going to be a viral video I'll make someday. 10 tips for vacationing with your cat. It's going to be really, really silly. Okay, Christina T has a question about YD. Right. So I have to be a little bit careful talking about this, because I know that there's, Hills is I have respect for them as a company. I think they certainly one of the 3 companies that does most of their research in pet nutrition in the world. And I'm a big fan of Hill's clinical diets in general. I think the mechanism behind YD is it's meant to be an iodine restricted diet. And that's supposed to reduce thyroid production in the body and lower thyroid hormone levels, effectively managing symptoms of hyperthyroidism. And it does seem to work in reducing the clinical findings, so the T4 levels. As you know, you do blood work, you do T4 levels. It does seem to drive those down and improve symptoms of hyperthyroidism in some cases for some of the time. However, as far as I understand it, the modifications done to the food to do that, there may or may not, when you feed a cat the cat food, and you want it to be complete and balanced, meaning that it's basically like astronaut food, that it has everything the cat needs. It should be able to eat that food and nothing else for the rest of their life and be completely healthy. That's a complete and balanced diet. And that's kind of what you're going for with most cat nutrition, right? Because most of us don't feed our cats multiple different foods a day. We just want to give them like a can or some kibble and be confident that the cat's going to be nutritionally healthy. I'm not 100% confident YD does that, at least not in the long term. And more importantly, I'm not 100% confident that it actually fixes the problem of hyperthyroidism rather than just masking it and making it look better on lab work without actually fixing the underlying issue. And particularly because there's so many other effective treatments for hyperthyroidism, I don't really see why you would use this somewhat questionable intervention, which is diet, when you have other things that work really, really well, like methimazole for medical management or iodine 131 for definitive cure. So, I mean, I'm sure somebody with a marketing degree and an MBA looked at the feline market and said, there's room in the market for this kind of food, and we can sell it and make some coin at it. Great. And they probably can, and they probably do. But is it really a use? And it probably is a tool for managing hyperthyroidism. But is it a useful tool? I don't think so. I think there's better tools out there. And is it superior to other existing tools? Nope. I think it's equal to inferior. So why would you use it? I don't know. Maybe if you're susceptible to marketing, I guess. I think it's much better to actually medically manage it and then treat it with iodine 131. So yeah, it's a tool that exists. I don't think it's the best tool out there. There's other tools that are equally better, as good or better. So I don't see why one would use it. Right. Let's see, what else? Yeah, cats love, I think it's I love my cats. I love it when they catch bugs. But, waking up in the morning to a cat licking your nose and then going out in the living room and finding a bunch of cockroach wings and legs there is a little bit questionable. All right, a couple of questions here. Valdegast asks, would you recommend routine testing for hyperthyroidism in older cats? Absolutely. T4 levels are part of every cat's geriatric panel, and I think every cat should get blood work done over the age of 8, as recommended by the American Association of Feline Practitioners. So absolutely, you should be doing blood work on your older cats once a year, and you should be checking T4 levels as a part of that blood work. There's a question about managing kidney disease and hyperthyroidism, which is a bit involved. So just guys, give me a second here. Oh yeah, if you have a summer house in the country, you can definitely take your cat there. Yeah, for sure. If you have a place that's stable and it's set up for cats, you can definitely take them with you when you travel. Just make sure that they have their flea medication and dewormers all up to date. Okay, somebody whose name I can't pronounce is asking me, is the life expectation of a cat treated with radioiodine better than one treated with medical management? Right. So, no, I think the life expectancy is the same, but I think the quality of life for the cat and the owner is improved because you don't have to do medication 1 or 2 times a day, every day for the rest of the cat's life, and there's no risk. And also, when you're on chronic medications, there's always the risk of missing doses, stuff like that, like going away on vacation, having to find a cat sitter who can give your cat medication. So I think radioiodine therapy improves quality of life. I think it's also more financially viable, I guess, just a good idea financially. I think as I mentioned in my hyperthyroidism video, when I run the math in Vancouver with our prices in our local facility, I think 2 to 2.5 years out from treatment, you're actually financially better off to have done the I-131 versus doing medication and proper monitoring. So I think it's a quality of life improvement more than anything else. Okay, so there's a couple of questions here about managing hyperthyroidism and kidney disease, and another one about worries about radioiodine unmasking liver or kidney problems. So let's talk about that for a little bit. Right, so kidney disease and hyperthyroidism are two of the most common old age-related diseases in cats. Think about 5 to 10% of cats get hyperthyroidism, like 30% of cats get kidney disease. So there's obviously going to be a big overlap in the population of animals who are old cats and have hyperthyroidism. A lot of them will also have kidney disease. Now, being hyperthyroid is actually hard on the kidneys, so it might actually, I doubt it actually causes kidney disease, but it certainly might exacerbate it. So there's definitely going to be an overlap there. The tricky thing is that being hyperthyroid masks elevation of kidney enzymes on blood work. So being hyperthyroid can make your kidneys look better than they are on blood work. It doesn't mean that, so if you have a cat with normal blood work, or normal kidney values, you start treating him for hyperthyroidism, and then like on your 3-week recheck, the kidney values have gone up. It doesn't mean that the treatment has made the kidneys worse. The kidneys were bad the whole time. It's just that now you can actually see it. And having kidney disease and hyperthyroidism is bad for the kidneys. It makes the kidney disease worse. So while treatment for hyperthyroidism unmasks on lab work the kidney disease, it doesn't make the kidney disease worse. And in fact, it makes kidney disease better. And there's no correlation between this and liver. So hyperthyroidism does elevate your liver values, but there's no correlation between hyperthyroidism and liver disease. So that's not really a concern. So treatment, whether you do medical management with methimazole or whether you do iodine 131 therapy, is going to be protective of the kidneys, because you're not just hammering those tender membranes in the kidneys with your high blood pressure and like your thyroid hormone. It's good for the kidneys, but it makes hidden kidney problems visible on blood work. And that has to not be confused with it causing kidney problems. It does not cause kidney problems. Treatment of hyperthyroidism does not cause kidney problems. It simply unmasks a pre-existing problem and makes it better. So I think I'm about as clear about that as I can be. Let's see, what else do we have here? Lindsay Smith asks, should we avoid fish cat food? Right. Oh, you know what? Super chat might not be available on this channel because it's still kind of small and it's not monetized. So forget about it. I'm happy to just answer your questions. Drop me. Yeah, don't worry about it. Yeah, this channel's not monetized. That's why there's no super chat option. So forget about it. All right. Fish food. So yes, so there are goitrogens in fish that basically, eating an all-fish diet is a predisposing risk factor for hyperthyroidism. Having said that, if you're feeding your cat complete and balanced cat food that is based on a fish protein, you don't have to worry about that. The cases where fish and diet can cause hyperthyroidism are cases where a cat is just fed whole fish for like a decade. So fish-based cat foods are safe and are not a risk factor for hyperthyroidism development. Hopefully that answers your question and puts your mind at ease. Okay, I have a question about blood pressure, which is kind of cool because a lot of hyperthyroid cats have high blood pressure. A lot of kidney cats have high blood pressure. And again, if you have both problems, you can get real problems with high blood pressure. Claudia, why are you beating me with your tail? Am I not paying enough attention to you? Okay, a question about checking blood pressure at home. Okay, so checking blood pressure on cats is really tough. So, I mean, there's no reason why you can't monitor your cat's blood pressure at home. But, okay, Claudia, stop trying to knock over the lights. You beast. You beast. You wicked little beast. Are you bored? Should I squish you? Right. So yeah, you can theoretically measure blood pressure at home, but it's really, really hard. Technically, you need a bunch of equipment that costs like $1,000. So yeah, I mean, if you want to go out, invest in equipment and do the training, you can do it. Now, we have something called oscillometric blood pressure measurement, which is these little digital blood pressure measurement tools that do make measuring blood pressure on cats much easier. But again, an oscillometric BP device is like, I think, $1,000 or $1,200 Canadian. So, I mean, it's a bit of an investment, and you still need to have a lot of skill to actually use it properly. So, yeah. You can do it, but it's not a good idea. Now, there's certainly at-home blood pressure measurement services. So, for example, in Vancouver, we have this awesome service called Meow Maids. Shout out to you girls, who are former vet nurses who, they have this service where they come to people's houses. They can do like at-home blood pressure measurements and blood draws and stuff. They're pretty awesome. I use them a lot. And if you have an at-home blood pressure measurement service, then that's a great tool because your cat's blood pressure at home will be more representative of the true blood pressure than blood pressure in a clinic. Blood pressure in clinics can be elevated. We have ways of accounting for that, but it's still not perfect. However, not everywhere has access to home nursing care for your cats, and obviously you have to pay for it. But yeah, you can get blood pressure measurements done at home by a professional sometimes if you're lucky. But doing it yourself is a bit tough. Okay, Rick Bear says, your videos are now being recommended by our recently opened emergency vet hospital. Yay! That's awesome. It's always been my dream. Oh, I just hit the microphone. Sorry, guys. I got so excited. That's been my dream, to have other vets use my videos to help their clients. I know the vets who work for me in my clinics leverage my videos somewhat, but I'm so happy to hear that. That's awesome. Because a lot of the videos I make, well, the silly ones are just for fun, but a lot of the clinical videos I make, I specifically make them to be consult room or consult side tools, which clinicians can use to help educate their clients, and also to help their clients remind their clients at home what they talked about. Because I think it's shown that people forget like 60% of what is said during a doctor's visit by the time they get home, because obviously, a lot of information, it's kind of stressful, weird environment. And one of the reasons I made my videos is so that clients can go home and review what I told them on camera or review what I told them in person and actually remember it. So I'm so happy to hear that. That's awesome. Thanks for sharing that, Rick Bear. Just made my day. Eugene asks, it's actually more like 5 to 10 or 10, 15, whatever. It's a percentage, around 10% of cats who get hyperthyroidism. Is there any sort of preventative measure for hyperthyroidism? Not really. No. Hyperthyroidism is caused by a little functional tumor of the thyroid gland. There's no way to prevent it from forming if your cat has a genetic predisposition for it. So you can avoid goitrogens, you can avoid, all fish diets, you can avoid doing obviously harmful things, but you can't actually stop hyperthyroidism from occurring beyond just feeding your cat a complete and balanced diet. So yeah, not all problems can be prevented, sadly, but screening for hyperthyroidism in older cats regularly will allow you to identify it early and manage it early before it really causes any harm to your cat. So you can avoid harm caused by hyperthyroidism by routine screening, and I'll never get tired of saying blood work every year for older cats, and then management of the disease. And that's really true for for many, many conditions, particularly age-related conditions. You can't prevent them from happening, but you can prevent the harm they cause to the patient by early diagnosis and appropriate treatment. Yeah, there's no super chat because the channel's not monetized. Oh well, one day. All right. So let's see what. Any more questions, guys, about hyperthyroidism or anything else? Again, this is a funny experience because we have such a small group here. Usually the questions are coming so fast, I miss like 2/3 of them, but that's okay. We can have a bit, we can just hang out, have a bit more of a chat. So, a question about white blood cell counts being low in clinic due to stress. Absolutely, yes. You can get mild leukopenia just from stress in the clinic. It's usually disregarded. Unless the patient looks septic, you don't really worry about slightly low white blood cells. So Laura's asking if in a cat who is drinking more water, if you can tell if it's kidney disease, diabetes, or hyperthyroidism. So I guess one way to tell is if you're comfortable palpating their neck, as I demonstrate in the hyperthyroidism video. If you run your fingers down their neck and you feel a big lump there, that's a goiter on our thyroid gland. They're quite likely to be hyperthyroid. However, they could also be hyperthyroid and diabetic, or hyperthyroid and have kidney disease. So it doesn't really rule anything out, and it's certainly not a replacement for vet exam. Also, in some patients who are really hyperthyroid, the thyroid gets so big it actually falls into the thoracic inlet and you can't feel it anymore. That's pretty rare, but yeah. So physical examination isn't that useful in this case, other than just kind of saying, okay, this cat needs a blood test. But it sounds like that cat you're taking care of could really benefit from blood and urine testing. Now, if it's like a feral or something, you can get kitty litters, basically like not litmus strips, but you can get kitty litter that changes color in response to sugar. And it's kind of a cool tool because you can just put it in the litter box and the cat pees on it. If it changes color, you can tell a cat has hyperglycosuria, so sugar in the urine, and that's really uncommon unless you're diabetic. So that's one way to screen for diabetes, but I don't know how useful that is for you. Okay. Veteran Cinder has a question about calcitriol. So your vet has not heard about calcitriol. Well, there's a lot of medications. There's a lot of stuff that the regular vets haven't heard of that I use routinely. Unfortunately, sometimes knowledge takes 10 or 15 years to permeate the profession. But asking for a second opinion from a doctor is normal and acceptable, and it'll never be taken the wrong way. As professionals, we always are bound to respect our clients' wishes. Giving second opinions and asking for second opinions is a normal part of medical practice, and you should never feel sheepish or concerned about doing so. It is, in fact, two heads are better than one in all cases. So just go ahead and ask for a second opinion from another veterinarian, and don't feel bad about it. Nobody gets upset if their client asks for a second opinion. All right, a question here: how young can hyperthyroidism happen? And in fact, I think in the pre-chat for the original live stream, somebody was asking about a cat that had hyperthyroidism developing at 4 years old. So that's an interesting topic. So normally hyperthyroidism is a disease of older cats. Statistically, it typically occurs in cats that are about 10 years old, plus or minus, or maybe a bit older. But juvenile hyperthyroidism can happen. It's very rare, but there are reported cases of cats as young as like a year old developing true hyperthyroidism. The tricky thing is that if you have a young cat with symptoms of hyperthyroidism, elevated T4, you have to kind of stop and ask yourself, is there anything else that could be causing this problem? So because we know that food can induce hyperthyroidism in cats who wouldn't otherwise get it, you probably want to look at a young cat who has elevated T4 and make sure they're not on a goitrogenic diet. If they're not, and you have an elevated T4, you're running a free T4 that's also elevated, they might be one of those ultra rare juvenile hyperthyroidism cases. And so there's a tool you can basically do. A radioactive scan where you feed the cat or inject the cat with a small dose of radioactive substance, and then you put them under a special detector. And if the substance localizes to the thyroid gland, it's basically, it tells you that they are hyperthyroid. It's kind of an old school test that used to be used to diagnose hyperthyroidism in cats and humans back in like the 60s and 70s. And it's no longer used because we have reliable blood tests, which are like much cheaper and easier to do. But with like a juvenile hyperthyroidism case, because it's not a typical patient population, you might want to do this extra like radioactive scan. But if that scan comes back positive, maybe your cat just has juvenile hyperthyroidism. Like I said, weird things don't happen often, but they do happen. And at some point you just have to trust the data. If all the data is showing you that cat has hyperthyroidism and they have symptoms consistent with hyperthyroidism, they probably have hyperthyroidism. All right. All right. Now the comments came rapidly and right on. I should know better than to ask people to ask me questions. All right, but I'm going to try to get through all of them. I can do this. Just stand by while I read this, please. I love that your cousin's dog loves going to the vet. Personally, I train my dog clients to love coming to the vet, or my dog patients. We always give them treats. I encourage clients who live in the neighborhood to come by the clinic and just give their dog a treat from the front desk. That way, when they actually need to come to the clinic for medical reasons, the dog is like super happy and excited to go there. So it's something I love doing, and I think a lot of vets do that. So, and most of the time it works. Oh, okay. Excellent question. Is it dangerous for people with low thyroid to handle hyperthyroid kitty meds? That's a really good question. I don't think it's dangerous to handle pill or liquid thyroid medication that would be absorbed through the digestive tract for people with low thyroid. However, if you're using transdermal medication, you may want to use like gloves when you apply it to your cat, because if you already have a low thyroid, if you get a little bit on your skin, you might get some absorption, and that probably wouldn't be great for you. Having said that, because cats are like, 5 kilos? If you're hyperthyroid, maybe 3.5, and humans are bigger than that. The doses that we give to cats are really infinitesimal on the human scale. So like, even if you take your entire cat's dose of thyroid medication, it's probably not enough to actually make any difference at all to you physiologically. So it is very, very safe. But, if you have clinical hypothyroidism and you're using a transdermal methimazole, wear gloves, or just be careful not to get it on your skin. But I wouldn't say it's dangerous, just, but it's good to have some extra safety factors built in. All right, here's a question. Jeff M says, your vet wants to do your thyroid test because they say that the stress of going to the vet can increase thyroid levels. That is not true. That stress of going to the vet cannot increase thyroid levels. So I don't know what that's about. Now, you do, once you start managing for hyperthyroidism, you have to recheck it, every couple of weeks until the thyroid levels have stabilized. And also, once like I mentioned earlier, if you have elevated T4, you might want to do a total T4 to back that up. But it's not because you're worried that the stress of going to the vet will increase thyroid levels. That is just not a thing that happens. That's not true. You do it because you just want to confirm your lab result. Do cats have Adam's apples? That's a funny question. So an Adam's apple is your larynx. And yes, cats have a larynx. Everybody has a larynx. It's just that in human males, it's prominent. In human females, it's not. And cats all do have a larynx. And it's structured a little bit differently from us, but it's about 90% the same. Okay, I have a question on phenobarbital for seizures. A little bit off topic, so I'm going to answer it really, really quickly. Use periodic blood work to check phenobarbital levels and liver function. Anything else to look forward of? No. That sounds like your little cat is being appropriately monitored. Phenobarb levels are great. You don't even have to do this. Honestly, I've worked with neurologists who don't do phenobarb levels, but they're a great piece of information. If there's any concerns about liver disease, you can do liver function testing. But if your cat isn't losing weight and nauseous all the time, there would be no reason to do that. And in fact, most cats on phenobarbital get kind of fat. So if they're doing well, then it sounds like your cat is being appropriately monitored. Heather's asking about, I'd love to know more about meow maids. Well, they're just a bunch of nurses who used to actually work at the clinic that I currently run before I bought it, who just struck out on their own, and they offer like an at-home service where they come to your house and they can do things like blood pressure, take blood samples, give your cat medication. They do cat sitting. So they're entrepreneurial ladies who provide a really awesome service in Vancouver. I can highly recommend them. And I think that I honestly, I think it's a great service. So if you're a vet technician or a vet nurse and you're thinking of striking out on your own and you're wondering if this is a viable business model, it is, and it's very useful and wonderful. You're welcome, Cinder. Okay, what else we got here? So Lara Moore is asking if diabetic cat urine smells different than regular cat urine. It does. Personally, I try to avoid sniffing cat urine if at all possible. But having said that, I would say that if your cat's urine suddenly changes smell or starts smelling really foul, that is actually a really good reason to do urinalysis. I've noticed that Mr. Pirate, when he gets a urinary tract infection, as he does quite often, his urine smells rank. And I've done it where I'm like, oh, Mr. Pirate, it's getting a little smelly today. So I take him to a clinic, I do urine culture and urinalysis and treat whatever I find. So it is actually fairly common. And while you would probably want to avoid sniffing a cat's urine if the smell radically changes, it certainly calls for a check. Might not necessarily mean diabetes, could mean a UTI, could be totally innocuous, but probably worth checking, I would say, worth checking. All right. All right, what do we get? Chicken or fish-based treats be better than beef treats for hyperthyroid cats? I don't think so. I think whatever treats your cat likes are good for your cat. Yeah. Okay, so Rick Bear has a question that their 15-year-old cat is on furosemide for congestive heart failure. If they miss a couple doses because they're not eating in the hot weather, will the diuretic effect clear fluid buildup? Well, you really don't want to miss any doses if you have a cat with heart disease receiving diuretic. Now, if it's really hot weather, maybe they're going to get a little dehydrated and that'll balance it out. But really, you should be giving your medication on schedule. And yeah, so I would not advise skipping any doses without consultation with your family veterinarian. Yeah, diabetic urine smells sweet. Yes, it does. Actually, it also tastes sweet. In the Middle Ages, diabetes used to be diagnosed by the physician tasting urine, and we're all very, very happy that especially the vets among us, are really happy that we moved past that. I'm sure the human doctors are too. It's no longer a useful diagnostic tool. Alina asks, how many times do people comment "Squishthatcat" to me? I would say millions of times. I have people approach me on the street and say "Squishthatcat," and certainly in the comments, I get random "Squishthatcat" comments, and it always puts a smile on my face. I should trademark that or something. I don't know. Should make more "Squishthatcat" shirts, although the ones I have sell quite nicely. Speaking of which, do you guys know that I have a Patreon store on my main channel? We have like mugs and shirts and stuff. They're really cute Squishthatcat designs, and we actually got some new designs. Some of them made by one of my staff, who's a graphic designer, and some of them made by the lovely Sim. So if you guys haven't checked out the new designs on my Redbubble store that is linked to from the description in the video and my main channel, linked to everywhere. Please do. There are some really cool new designs out. All right. Let's see how many. Okay, questions. We got someone in New York. Okay. One second. I'm going to take a moment to read. I wish there was a cat around to entertain you guys, but they all buggered off. It's really hot here. I assume they're sleeping somewhere in shady. Oh, Claudia's out on the balcony. Okay, somebody's got a question from Reddit. Is it safe to use scented candles around a cat? Yes, it totally is safe. I mean, some essential oils can be toxic to animals, but I think tea tree oil is quite irritant. But realistically, unless you're locking your cat in a small box with a scented candle, if they find the smell unpleasant, they can just remove themselves from it. Where people get into trouble with essential oils is when they like give them to the cat and they're like water or food, or like pill their cat with essential oils. That is a terrible idea. Don't ever do that. But if you have a scented candle with essential oils, the cat can just walk away from it if they don't like it, and so it's not really an issue. Also, our cats won't let me comment because apparently I'm not legitimate enough. I spent some time on Reddit, but it's funny, like our pets and our cats, they're just like, nope, you're not a legitimate Redditor. We don't want your opinions on things. Okay. Right. Meg is asking about her 4-year-old cat having been diagnosed with hyperthyroidism. So maybe you weren't here a few minutes ago when I talked about that. The juvenile hyperthyroidism is a thing. It's a rare thing, but it's a thing. So maybe if you missed it, just rewatch the live cast once we're all done. It was just, we're at minute 56. I was probably talking about it around minute 40. So just have a look there. And I kind of went over why juvenile hyperthyroidism may be a legitimate diagnosis. Eugene is asking, how do I get my cat to eat wet food? He will rarely eat it and wait for dry food instead. Well, you can bring a horse to water, but you can't make it drink. You can offer the wet food and just realize that, well, kibble is, I guess, a higher value food item for cats because it's more calorically dense. So most of them will like wet food, assuming they don't have like a food addiction that's preventing them from eating anything but that one food that I've always had. Realistically, you can just offer to them. And if they do eat the wet food, you can gradually reduce the amount of kibble you offer. And as you do that, they'll just make up the difference with their wet food. You can also try mixing the wet food with the kibble. I have a video on how to get a cat to eat new food on my main channel that you might want to check out and use. The only kind of caution I would advise is that you never want to starve a cat. So if the cat doesn't want to eat food, you don't want to just be like, oh, I'll leave this food out and, they'll get hungry eventually. Well, no, a cat will literally die before they eat a food that they don't like sometimes. So unlike dogs, in which I would take that approach, with cats, you just have to be kind of gradual. But I do have a video that goes into some fairly in-depth into how to get a cat to eat new food. So I suggest you check it out on the main channel. All right. So we're going over an hour here, so probably going to wrap it up pretty soon, but I want to see if there's any really cool questions I can get to before we put a wrap on this. It's very, very hot in Vancouver right now, so I think I might be getting heat stroke sitting in my studio. No, just joking. I'll be fine. I got my grommet mug full of rehydration fluid, also known as tea. Hey, Reggie, I'm happy that you like the Mr. Pirate Shoulder Ride t-shirt. I think that was actually my idea. I came up with that. Place cat here. Yeah, and I love giving Mr. Pirate shoulder rides. I wish I could demonstrate a shoulder ride for you guys right now, but I just have no idea where Pirate went. He was here earlier, but he has disappeared. So Ham and Cheese asks if I have any resources on my channel about respiratory problems. Well, not. I haven't actually done a lot of respiratory disease videos. I do really want to do a feline asthma video. Like cat asthma is like a huge interest of mine, and it is so underdiagnosed by general veterinarian population. Like cat asthma gets missed so much. So I really want to make a video about it. It's on my to-do list. My next clinical video is going to be on inflammatory bowel disease and lymphoma, finishing the series of 3 most common old age cat diseases. I'm hoping to get that done within the next week or two, although I'm taking some vacation in August, so it might not get done to early September. However, I think my next clinical video is very likely going to be about asthma because it's just such a big interest for me. Your cats are really against feline starvation, Valdigast. Yeah, one of my favorite memes of the year is newsflash: local cat never fed, according to local cat. Yeah, they're very adamant that they're dying from starvation. Some they haven't seen a kibble in 5 minutes. So yeah, as a note about exotic zoo cats, given fast days in a week, like, yeah, large predators, so carnivores like lions and stuff, they have a very different feeding biology than middle of the food chain predators like house cats. So uh, like lions will not eat every day, right? Because they hunt big prey and they have these high failure rate, high reward hunts where they might not eat every day, and you try to replicate that when they're held in zoos. Um, by contrast, house cats, they have a very high frequency of hunting. A cat in the wild will eat 12 to 16 small meals a day, meaning they'll kill 12 to 16 things and eat them, like a little mouse here, a little fish there. So they have a very, very different feeding pattern from great cats. And therefore, when we live with them and provide their food, we have to take a very different strategy to managing their intake. Fast Philly says, your cat gets regular depot injections for asthma. Not my favorite way of managing asthma. In fact, a terrible, 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 stupid way of managing asthma. I would get a second opinion, preferably from an internal medicine specialist. Use inhaled medications. Don't do weekly depot injections. That stuff messes your cat up. It really increases the risk of diabetes, joint disease, heart failure. Not a good idea. Very old school, very out of date. Don't do that. Find better ways of managing that asthma. Ugh, depot injections. Like some vets use it every week, and I'm ashamed to say they're members of my profession. I use depot injections like once every 2 years, and sometimes I think that's too much. Okay, what else we got here? Yeah, cat asthma vid. Thank you for the encouragement. I've been thinking about that for like 3 years. All right. I think we might wrap it up right there. One second. There's a question from Rick Bear about his little heart disease kitty. No, I'm happy to hear that you're getting meds in on time for my advice. That's awesome. Fast Philly depot every other month. I mean, better than every week, but still, there's a better way. There is a better way. Bing, bada boom. What do we got here? We finally got a lot of viewers. All right. How often do servals eat? I think servals eat like 1 meal a day or 2 meals a day. I'm not 100% sure. I do have a serval patient that I'm taking care of right now that's being fed like whole rats and mice. I suspect that a serval's eating pattern would be very similar to a regular house cat. So probably I would definitely daily and maybe a couple meals a day would be my best guess. But I'm not 100% certain of this. But from what I know about their biology, and from what I've seen work within circles that I've taken care of, I think I would feed them like a normal house cat. So a couple of meals a day. My advice on adding tuna water help your cats. Nice. Yeah, definitely makes a cat's life a little bit better. HN has a poop question. So, all right, you have a question. Your cat basically had a bowel movement while they're asleep. Look, if it's a one-off thing, maybe that I wouldn't be too excited about it. Fecal incontinence can be caused by a variety of neurologic problems. But if you have an otherwise normal cat who dropped a poop once in their sleep, it was probably just on its way out and the cat didn't notice, or maybe it was stuck to their hair. Long-haired cats will sometimes have poop stuck to their hair, and it gets pretty gross back there. Then, without going into too much detail, but if you have a cat who suddenly starts showing fecal incontinence, i.e., dropping little poops around, when they're asleep or just when they're walking around without obvious effort, then you definitely want to get them in for a neurologic examination, because that can be caused by spinal cord problems as well as peripheral neuropathies. Also, if your cat has recently had surgery on the back end, you might want to consult with the surgeon. Not really a common problem, but again, if it's a one-off thing, don't worry about it. But if it becomes a routine thing, then you definitely want to have a neurologic examination, focusing on the lumbar spine and the lumbosacral spinal segment, if that helps. Watching Sopranos are good, fellas? Watch them both. I love them. Yeah, Sopranos is actually, it was like the first HBO show that had or at least, yeah, I think Sopranos was probably the first HBO show, or one of the first shows out there that actually decided to drop the adventure a week format and actually have a continuous story throughout the whole season. Really revolutionary. Fantastic. It's a little older now, but for those of you who haven't seen it, I highly recommend. Okay, Meg is asking, are there any specific blood tests that clearly define kidney disease? So yeah, they should be a part of every basic cat screen. So measuring urea and creatinine is a part of every basic cat blood chemistry. Remember, you also need to do a urinalysis at the same time. So you can't really assess kidney function without doing blood and urine. So you have to do blood work and urinalysis from roughly the same time point, or a couple days apart is fine, to properly assess the kidneys. And then IDEXX has a new test called SDMA, which is basically a proxy for glomerular filtration rate that really helps with early detection of kidney dysfunction. But again, it has to be interpreted in light of urinalysis results and general clinical status, because no test on its own can tell you the whole story about your patient. You have to really integrate your information. Claudia, why do you have a giant hair? I just pulled this giant hair out of Claudia's mouth. Disgusting. Why do you have a giant hair in your mouth? Okay, everybody comment if you've ever pulled a giant hair out of your cat's mouth that's just hanging there. Come on, I know you've all done it. Gross little kitty. Well, Scaringer's asking if I'm ever planning to do a day in the life of a vet clinic. Yeah, I've thought of it. I'm a little concerned that a lot of the stuff that happens in the vet clinic is a little too stressful and gory for general YouTube viewing. But I've certainly, I do little on this clips channel. I actually do little clips from clinics, but usually of just really cute patients. So, if I see a kitten or a cool chameleon or a turtle or something, I'll throw a clip up on the clips channel just so it doesn't come up my main channel. Doing a proper vet clinic show, I don't know if I'm really into that. It's been done by networks. I'm not really super into it. I have been thinking of doing a YouTube. So, okay, this might be a little bit too early to announce this, but I've had this idea. I'm going to share with you guys. This is a Help of Vancouver Vet exclusive. Yeah. Oh, dental floss, shoestrings. Oh my God. Yeah, cats are so gross sometimes. Most of the time, they're delicious and beautiful and smell nice, but they can get so gross sometimes. All right, guys. So, Help of Vancouver Vet exclusive announcement. I've been thinking of doing a little YouTube show or YouTube episodes. It will take a lot of work, called The Perfectly Managed Case, in which what I would do is take a complicated medical case, a sick animal whose owners can't really afford proper treatment or can't really afford the best treatment that's on offer, and basically treating them pro bono, documenting it and making a little YouTube video out of it, and then putting up like a Kickstarter and getting my audience to pay the bill. What this would do is it would allow me to actually do like perfect medical management, which is such a rare luxury in the veterinary world because we're so often restrained by finances and owner resources. And so allow me to just focus on the medicine, do like a perfect case management, like get the best possible outcome for this patient without going bankrupt. Because obviously I can't do that for every patient I have. People have to take financial responsibility for their own pets. But I thought it'd be cool to do that, document it, and then have basically crowdfund the treatment so that the clients, basically the public, because they have like hundreds of thousands of subscribers. If everybody gives me $1, I could help like 1,000 animals, live their best possible life. So that's kind of thinking about that, but it's still implementation. Because recently I was helping a friend of mine who doesn't have a lot of money, that has a very sick cat. And I've just said, you know what, forget about it. This is one case. I'll just do it pro bono. I won't charge you anything, or pay whatever you can. I'll do whatever I can for your cat. And it's been so nice just treating this cat without having to ask the client for permission to pay for stuff and worrying about finances. And, it's probably going to cost me a couple $1,000, but all said and done. But in the bigger scheme of things, it's, clinic operations. It's not a big deal. And it's just very, very rewarding. So I thought that would be a pretty cool thing to do. But it has to be implemented properly. But yeah, I'm glad. Oh, it sounds like you guys approve. It's a very positive feedback about that. Oh, Kelly, that's very sweet. I know a lot of clinics offer like in memoriam donations and run like, or have like non-for-profits where people can donate to help needy pets. They're all very complicated and there's a lot of pitfalls around doing that. So while I've over, my 13 years of clinical practice, I've really thought about doing that. I've never really implemented it, but I think because of my YouTube audience, I'm using like a Kickstarter crowdfunding model to fund pets that I deem and clients that I deem worthy of it. And then being able to do a really like thorough, satisfying case management on them would be really cool. And it's kind of a unique opportunity. The other thing about the perfectly managed case concept is I think it'd be really nice to put it out there to show people what can be done for their pets when finances aren't a limiting factor. And I think this would be a really cool thing to get out there, because I think a lot of people's experience of vet care comes through that filter of like, what can I afford? What can my vet do? What can my vet offer? And often what the vets offer isn't necessarily everything that can be done, because they're also very cognizant of dealing with owners' financial limitations. So I think demonstrating to people what can be done where money's not an issue will be really interesting, and hopefully maybe bring up the standard of vet care a little bit, maybe make pet insurance a little bit more popular, because again, I'm a big believer in pet insurance because it really takes away that financial angle from when you're making decisions about your pet's life. So I think it'd be very beneficial, but I really want to really put some thought into this and really do it right if I'm going to do it. But thank you very much for the encouragement. I'm seeing a lot of very positive feedback. That's really nice. All right, guys. I think I'm going to call it a day there. Thank you very much for joining me for this intimate and cozy live cast on the Help of Vancouver Vet Clips channel. I'm going to do my future live casts on my main channel. Like I said, this is just like a one-off little fun promotional thing. But yeah, thank you very much for joining me. This will be posted, so if you missed a part of it, you can go back and review. And please subscribe to the Clips channel, help it grow. And yeah, just squish your cats on my behalf. Bye, everyone.